Okay, let's get into this. You know that feeling, right? When you're trying to understand some medical information. Maybe for yourself, maybe for your pet.
Oh, yeah. It's just this wall of jargon sometimes.
Exactly. It feels like trying to untangle this huge knot of complicated terms.
Hmm.
So today's deep dive, we're aiming to cut through that, specifically looking at something called bile peritonitis.
Right. And the name, Bile Peritonitis, it sounds maybe a bit intimidating,
Mhm.
but the core idea is actually pretty straightforward. It's
Yeah.
basically a chemical irritation, inflammation, really. It happens when bile, that digestive stuff from the gallbladder and bile ducts,
Hmm.
when that leaks out into the belly, into the abdominal cavity.
Right. Bile's needed for digestion, breaking down fats, but it's also pretty harsh stuff on its own.
Definitely caustic.
So if it escapes where it's supposed to be and hits that sensitive lining inside the abdomen,
Yeah,
yeah, that causes trouble.
big trouble.
We're using pasted text as our source today, and it gives a really thorough overview. So our mission for you listening is to pull out the key stuff about bile peritonitis.
Like the causes, the signs.
Yeah, the signs, how vets figured out the
Mhm.
treatment, but without getting totally swamped by the super technical bits. The goal is for you to feel informed, kind of empowered, not overwhelmed.
And it's worth noting this isn't always just a tiny contained issue. The body does have defenses, like the omentum. It's this fatty tissue that can sometimes, wrap around a leak and try to seal it off.
Oh, interesting. Like internal damage control.
Sort of, yeah. But bile peritonitis can still spread, sometimes through the whole abdomen. And the source mentions it seems to be more common in dogs compared to cats.
Okay, good to know. So bile leaks causes inflammation.
Yeah.
What are the specific things people should be looking out for? What are the actual signs?
Well, how it shows up can really vary quite a bit. The source talks about it being acute, meaning it comes on fast and can get really severe, especially if it turns into septic peritonitis. That's a whole other level.
Septic means infection, right?
Exactly. A widespread, really dangerous infection in the abdomen, bacteria running wild. But other cases might be more chronic. Signs kind of creep up over time.
Lower onset.
Yeah. And then there are these rare cases the text mentions, which are kind of surprising, a silent rupture.
Silent, meaning no signs at all.
Initially, maybe not obvious ones, the omentum we mentioned might contain the leak at first. So yeah, tricky.
Wow, okay. That really shows how sneaky it can be. So even if things seem okay on the surface.
Something could be brewing inside, yeah. But for the cases where symptoms do pop up, what might an owner actually see?
Right, what are the clues at home?
Owners might notice just like vague belly discomfort, their pet seems off.
Not quite right.
Yeah. Or general lethargy, low energy. GI signs are common too, not eating, vomiting, maybe diarrhea.
Okay.
Weight loss can happen, especially with those chronic ones. You might even see the belly looking swollen, and sometimes jaundice, that yellow tinge to the skin, gums, eyes.
Ah, the yellowing. That points to liver or bile issues often, doesn't it?
It does. And in really bad situations, if that septic peritonitis kicks in, the animal could actually collapse. It's that serious.
Okay. And what about when the vet examines the pet? What might they pick up on?
Well, they'll likely confirm that lethargy. Abdominal pain is another really common finding.
Peeling the belly.
Yep. And the source points out the pain is often worse or more obvious in the front part of the abdomen.
Near the gallbladder area, presumably.
Exactly. Jaundice is another key thing they'll look for. They might be able to feel fluid buildup in the belly too. And depending on how bad it is, maybe a fever if there's infection, or signs of endotoxic shock if it's gone septic. That's a really critical state.
Okay, so we have a picture of what it is and what the signs are. Let's dig into the why. What actually causes this bile to leak in the first place?
There are actually quite a few potential culprits. One big one mentioned in our source is problems with blood flow to the gallbladder wall.
Oh, like a supply issue.
Yeah, specifically the cystic artery. If that blood supply gets reduced or cut off, the tissue can die, that's necrosis, and then the gallbladder can just rupture.
Wow. What else?
Trauma is a major one. Think car accidents, surgical complications sometimes, even bite wounds or gunshot wounds, anything that physically damages the gallbladder or bile ducts.
Makes sense. Blunt force or penetration.
And the common bile duct specifically seems pretty vulnerable to rupture with blunt trauma, according to the text.
Are there causes that start inside the body, not from external force?
Oh, absolutely. Inflammation of the gallbladder, that's cholecystitis, or the bile ducts, cholangitis, that can lead to leaks.
Just inflammation itself?
Yeah, especially if it's severe. The source brings up gallbladder mucosalis, too.
Mucosalis. What are those again?
It's basically this buildup of really thick, sludgy mucus inside the gallbladder, and those are linked to inflammation and potential rupture. The text really emphasizes that if the inflammation gets bad enough to cause tissue death, they call it necrotizing cholecystitis, the risk of septic peritonitis goes way up.
Okay, so inflammation and those mucocilies are key internal triggers. What about blockages, like a plumbing problem?
Precisely. Blockage of the main bile duct outside the liver, the extrahepatic biliary duct, or EHBDO, that's another major cause.
And what causes the blockage?
Could be a few things. Tumors pressing on the duct, gallstones getting stuck, pancreatitis, inflammation of the pancreas nearby, or even just a narrowing of the duct itself called a stricture.
So, lots of possibilities.
Yeah. And the text also mentions sometimes you get these small, localized leaks linked to just cholecystitis, where maybe the omentum manages to contain it for a while.
Right, that natural patch.
But the really critical point is that even if it starts as just chemical irritation from the bile, that irritation can actually pave the way for bacteria to take hold and cause that really dangerous septic peritonitis. The bile kind of damages the surfaces, making them vulnerable.
Okay, that's a crucial link. Chemical irritation can lead to bacterial invasion. So, given this wide range of causes, how does a vet actually pin down that bile peritonitis is the problem and not something else that looks similar? What's the diagnostic journey?
Yeah, it's definitely a process of elimination. Sometimes you have to differentiate it from other things. Our source lists some key differentials.
Like what?
Well, other inflammatory conditions of the gallbladder or ducts, those various causes of EHBDO we just talked about, like stones or tumors, sepsis coming from somewhere else entirely.
Okay.
Even things like fluid buildup, ascites from advanced liver disease, or other causes of jaundice and abdominal fluid that aren't directly bile related. So you got to consider the whole picture.
Right. Rule things out while looking for positive signs. Let's talk about those signs. What about lab work?
Wow.
Blood tests, urine tests.
Those are usually the first steps. A CBC, complete blood count, and a biochemistry profile, plus a urinalysis.
What might they show?
The CBC might show inflammatory changes, like a high white blood cell count, especially if there's a nasty infection going on. Or maybe anemia, low red cells, if it's been a chronic issue.
And the biochemistry, that looks at organ function, right?
Exactly. You'd often see high liver enzymes. ALP, alkaline phosphatase, is often quite high. High bilirubin, which explains the jaundice. Maybe low protein, specifically albumin, sometimes signs of kidney stress too.
Okay.
Electrolyte imbalances are also common. Low sodium seems to pop up frequently, maybe from fluid shifts. And the urinalysis. You might find bilirubin actually spilling into the urine, another clue pointing towards a biliary problem.
Are there any other, maybe more specialized lab tests that help?
Yeah.
Beyond the basic screens?
Yeah, sometimes. If they suspect a really severe infection or if the blockage seems like it's been there a while, they might run coagulation tests.
To check blood clotting.
Right. Clotting can go haywire with bad sepsis, something called DIC, or just with chronic blockage affecting vitamin K absorption, which is needed for clotting.
Okay. Then we move on to looking inside, right? Imaging, X-rays, ultrasound.
Yep. Abdominal x-rays. They might show sort of a fuzzy, poor detail inside the belly because of the fluid, maybe a hint of a mass effect up near the liver.
But maybe not super specific.
Often not. Rarely you might actually see mineralized gallstones if they're dense enough, or maybe gas in the biliary system, which is a big red flag for a certain type of infection. Chest x-rays are usually more about checking for related trauma like broken ribs or ruling out fluid in the chest, which is uncommon, but possible.
So ultrasound sounds like it would be the more valuable tool here.
Oh, absolutely. Abdominal ultrasound is huge for this. It's great at detecting fluid in the abdomen. That's usually pretty obvious.
Okay.
And if there is a blockage, an EHBDO, it can often show the proof. A dilated, stretched out gallbladder or common bile duct.
Ah, okay. Direct evidence of backup.
Exactly. Plus, ultrasound gives a really good look at the gallbladder and duct walls themselves. Are they thickened? That suggests inflammation. In really bad cases, like that necrotizing cholecystitis, the wall might look irregular, maybe even layered.
Wow, detailed stuff.
It can be. Ultrasound can also spot fluids specifically around the gallbladder. It can find masses in the liver or pancreas, which sometimes go hand in hand with bile peritonitis. It can see gallstones or those mucosally. Sometimes they have this specific look the source calls a kiwi fruit sign.
Kiwi fruit sign.
Yeah. And gas within the gallbladder or ducts that shows up as a bright echo with shadowing strongly suggests infection. Actually seeing the hole where the gallbladder ruptured can be tough, but ultrasound usually provides a ton of strong circumstantial evidence.
And the liver itself.
Interestingly, the liver size is often normal, but how the liver tissue looks on ultrasound, its echo texture, can vary. It might reflect other underlying liver issues happening at the same time.
Okay, so imaging gives us a great look inside, but it sounds like the real smoking gun might be analyzing the fluid itself, if there is fluid in the abdomen.
You are spot on. Getting a sample of that fluid abdominocentesis, or an abdopap, is often the crucial diagnostic step.
And they use the ultrasound to guide that.
Yeah, usually. Helps collect it safely and ideally from near the biliary area without poking the gallbladder itself if possible. Then that fluid gets sent off for analysis.
What kind of analysis? What are they looking for in the fluid?
Several things. First, just looking at it, what color is it, how thick? Then cytology, looking at the cells under a microscope.
What does cytology tell you?
It can give quick clues. Are there lots of inflammatory cells? Are there bacteria visible? Sometimes even cancer cells. In bile peritonitis, the fluid is often what's called an exudate or a modified transudate, basically thick inflammatory fluid. You might see bile pigment, bilirubin crystals, maybe inside cells or free-floating.
Okay.
If they see mucus-like material without many cells, that points towards one of those gallbladder mucosals rupturing. But the really big one
The key test.
is comparing the bilirubin level in the abdominal fluid to the bilirubin level in the patient's blood. If the fluid bilirubin is way higher, like the source says a ratio of 2 to 1, 3 to 1, or even more, that's a very, very strong indicator of a bile leak.
Ah, that makes sense. The bile is concentrating in the leaked fluid.
Exactly.
And I assume they also want to culture that fluid
Yeah.
to see if bacteria grow.
Absolutely essential. Bacterial culture, both aerobic and anaerobic, is done on the fluid. And if they go to surgery, they'll likely culture the gallbladder wall, maybe liver tissue, the bile itself.
What kind of bacteria usually show up?
Mostly gut bacteria, as you might expect. Opportunistic bugs from the GI tract. E. coli, Enterococcus, anaerobes like Clostridium or Bacteroids. It's often a mixed bag, multiple types of bacteria growing.
Okay. And speaking of surgery, the text mentions exploratory laparotomy. Is that mainly for treatment or sometimes just for diagnosis too?
It's often both, really. It's frequently the definitive way to get the final diagnosis and provide the treatment. Going in surgically lets the surgeon actually see everything.
Lay eyes on the problem.
Right. Find the exact source of the leak. Is it the gallbladder, the duct? Then they can do what needs to be done. Maybe remove the gallbladder, that's a cholecystectomy. Maybe repair a tear in the duct. Sometimes they have to reroute things if the duct is too damaged, create a new connection to the intestine.
Complex stuff.
It can be. And while they're in there, they'll usually take a liver biopsy too,
Right.
to check for any underlying liver disease that might be contributing or complicating things. But they're careful to take it from an area away from the immediate gallbladder inflammation so the results aren't skewed.
Got it. And then pathology on any tissues removed gives the final answer on the cause.
Yep. Depends on what they find. Was it inflammation, necrosis, trauma?
Okay, so let's say they've confirmed it.
Yeah.
It is bile peritonitis. What's the treatment plan look like?
First off, our source makes it clear. These patients need to be hospitalized. Inpatient care is a must.
No question.
How quickly they rush to surgery depends a bit on how stable the animal is. The absolute first priority is stabilization. Lots of 5E fluids, yes. To correct dehydration, electrolyte problems, acid-base imbalances, and starting antibiotics right away, broad-spectrum ones.
Even before knowing the exact bacteria.
Yes, because infection is such a high risk, or often already present. If surgery has to be delayed for some reason, they might do something called abdominal lavage, basically flushing out the abdominal cavity with sterile fluids to try and dilute the bile and bacteria, reduce the contamination load.
Okay. And surgery itself sounds like you want someone experienced.
Definitely. Biliary surgery can be tricky, so having surgical expertise is really important for a good outcome. The decision on whether to actually remove the gallbladder, the cholecystectomy, is usually made during the surgery.
Based on what it looks like.
Yeah, if the wall looks unhealthy, discolored, thickened, damaged, it usually needs to come out.
Okay. What about medications? We mentioned antibiotics are crucial.
Absolutely central. Started broad spectrum before surgery, targeting those likely gut bacteria, gram-negatives, and anaerobes. Then, once the culture results come back,
They can fine-tune the antibiotics.
exactly, tailor it to the specific bugs identified. And the course is usually long if infection is confirmed. Think 4, maybe even 8 weeks of antibiotics.
Wow, okay, long course.
Yeah. Also, for jaundice patients, giving vitamin K1 beforehand is common.
To help with clotting.
Right, because liver or bile duct issues can interfere with vitamin K absorption needed for clotting factors. They'll also often prepare for the possibility of needing blood products like plasma or whole blood or other supportive fluids like colloids during or after surgery.
And managing symptoms,
Yeah.
nausea.
Yep, anti-nausea meds, antiemetics are frequently used. If there's worry about stomach irritation or ulcers from the stress or bile reflux, things like H2 blockers or sucralfate might be given.
I also saw mentions of ursodeoxycholic acid and antioxidants.
Right. Ursodeoxycholic acid, sometimes called UDCA or URSO, is interesting. It helps make bile flow better, and it's thought to have some liver protective effects.
When would they use that?
Maybe in specific cases, like with gallbladder mucosa, certain types of gallstones, or chronic hepatitis, if that's also present. Sometimes it's used longer term if those underlying issues remain.
And the antioxidants,
Right.
like vitamin E, same.
Those are more for general liver support, helping protect the liver cells from ongoing damage or stress. Same, ecidonosilmethionine is often used. The dose might vary depending on if it's just for general support or trying to actively help bile flow too.
Okay. So after the surgery, the initial critical phase, what's the follow-up like? What should owners expect during recovery?
Close monitoring is still really important. Recovery isn't instant. It usually involves repeating blood work periodically.
Checking liver values again?
Yeah, seeing if those liver enzymes and bilirubin are coming down, checking white cell counts, maybe follow-up ultrasounds to make sure there's no new fluid accumulating, no signs of ongoing leaks.
Could they tap the abdomen again?
Potentially, yeah. If there was significant infection or concern about leaks, repeat abdominocentesis might be done to check the fluid again, make sure the infection's cleared.
And are there specific complications that can crop up after the initial treatment? Things to watch out for?
There are a few possibilities. Ongoing inflammation of the bile ducts or the liver itself, cholangitis or cholangiohepatitis. Pancreatitis is another risk, inflammation of the pancreas because it's so close by.
Wow.
And if they had to do one of those surgical rerouting procedures, connecting the bile duct to the intestine, there can be a risk of bacteria ascending up into the bile ducts later, causing recurrent infections.
Okay, so potential bumps down the road.
Yeah.
Now the big question, what's the overall outlook? The prognosis for pets with bile peritonitis.
It really depends on one key factor. Was it sterile or septic?
Infection makes all the difference.
Huge difference. For sterile bile peritonitis, meaning just the chemical irritation, no major bacterial infection. If the surgery is successful, the survival rate is generally pretty good, though it still depends a bit on why it leaked in the first place.
But if it's septic,
The picture changes dramatically. The mortality rate for septic bile peritonitis is much higher. The source cites figures up to 73% mortality in some studies. It's incredibly serious.
wow, that's sobering.
It is. And even for the survivors, owners should expect recovery to be slow sometimes. Getting back to full health, seeing those liver enzymes completely normalize on blood work, that can take time. The jaundice, though, that yellowing, that usually improves much more quickly once the leak is fixed and bile flows normally again.
Okay, let's try and tie this all together then. Key takeaways. Bile peritonitis is serious stuff. Bile leaking where it shouldn't, causing inflammation.
Right, chemical burn inside, basically.
And spotting those signs early, even vague ones like lethargy, maybe some vomiting, belly pain, definitely jaundice, that's super important.
Absolutely critical for getting timely help.
Then the diagnosis involves a careful workup, blood tests, urine, definitely ultrasound, and crucially, analyzing any abdominal fluid, checking that bilirubin ratio.
And looking for infection, yeah. That fluid analysis is often key.
Treatment means stabilizing the patient, usually surgery to fix the leak and maybe remove the gallbladder, plus supportive care, and really importantly, antibiotics, often for a long time if it was septic.
That sums it up well. Stabilization, surgery, antibiotics.
And the outcome really hangs on whether that infection took hold. Sterile cases do much better than septic ones.
Night and day difference, often.
Well, hopefully this deep dive, digging into the source, has given you, our listener, a clearer picture, a better handle of what bile peritonitis involves without being too overwhelming.
Yeah, I hope it helps demystify it a bit. It's complex, but understanding the basics, the leak, the inflammation, the risk of infection is key.
Absolutely. And, thinking about all those different causes we discuss, trauma, inflammation, mucoscalis, blockages, it does make you wonder, doesn't it?
Wonder what?
Well, are there any proactive things someone could even discuss with their vet? Steps to support their pet's general biliary health? Maybe catch underlying issues earlier? Certainly something to think about and maybe chat with your vet about next time you're in.